Hi, this is Dr. Antolak from theGentlDentist.com in Shelby Township, Michigan. 586-247-3500 is our phone number. And what I have here is a skull, and I actually have a computer program which can read a CT scan or a cone beam CAT scan. The benefit of a cone beam CAT scan, unlike a regular x-ray you get at the office, the dental office, is it gives us the ability to see things in 3 dimensions. And what I want to do is to demonstrate that, not on this person, but on an actual live patient that we took an x-ray of before. I had a scan done of him, and we did some virtual placement of some implants in that. And I just want to show you a comparison about what this can show versus what happens in a skull. Okay, so as we see here in this picture here, we can see within this skull we have, let's see your brightness. Okay, so this shows, for example, a skull, something like this. Okay, but now what's really neat is we can take that skull and we can actually turn it like this. Okay, and we can make it look on the side like that. There we go. So, and then we can able to twist it around like that and manipulate it to make it look like there's actually, like it's like I'm holding its skull, except it's all done through the computer. Or we can make it tip up like that and look like underneath the chin area here. All right. And what it also gives us the benefit in this person is we can actually determine and map out where the nerve of the jaw is in the bone. We can map out where that is, and then in relationship to, let's say, for example, we wanted to put a virtual placement of an implant in, we can place that implant in here, and then we'll know just exactly how far it is from the nerve itself, and then we know the length of an implant to place at that point. Now, how this is generated is through 3 different axes. One axis actually is an axis that cuts off like this. The other axis gives us this section here where we can look at the cross section. For example, let's say of this jaw right here, we can take it cross section like this shows, and this shows right where this tooth is here, where you see these little cross hatches are here and here, and that shows right where this implant is. Okay, and so what it does is we can actually go through, and as we move this blue line here, if you can see the blue line, as it moves back, we can see what that cross section looks like, and then we can see any of the details that are that are showing us in the scan itself. So as we go through, we can see how, for example, how this is changing. So as we roll through it, we can see, for example, the red area there is where the nerve is, but now we're back further, and if we want to move forward, we can put a virtual placement of an implant, which is in green right here, and it will let us know how far we are to the nerve, where we are in relationship to the extent of the bone, and so we know the angulations that we can use. We then know also, like I say, the lengths and exactly the positions to put them in. And so this just gives us the ability to be more precise. It gives us the ability to make sure that when we do something, we hopefully just do it one time, and then it's a favorable result. This is called a cone beam CAT scan. Unfortunately, in Michigan, there are only a few areas where you can get these. The state of Michigan, its regulations are pretty strict on who they let open them up, to have these abilities for these dentists to have a cone beam CAT scan. But we can definitely get you off to the right place to get that if it seems like it's an appropriate thing for you, and a way to help use our technology for a better improvement, not only your health, but also for your entire smile. So thank you, and if you have any questions, please call us at 586-247-3500.